Hi everyone, welcome to Ask the Horse Live. I'm your host, Michelle Anderson, Digital Managing Editor of The Horse. Tonight we're talking about managing the aging equine athlete, and the event is brought to you for free tonight by Equine. Sometimes it seems like just about the time you get your horse really good at his job, he starts getting old and a little bit tired, a little bit sore, a little bit slow. And anyone who has an older athlete, and I'm one of these owners, would do just about anything to keep their horses going in top competitive form. So tonight we have the help of Dr. Rashmir Raven and Dr. Ann Rashmir Raven and Dr. Erin Denny Jones. Welcome to both of you, doctors.
Thanks for having us, Michelle.
So let's start with you, Dr. Rashmir. Can you tell us a little bit about your experience and interest in helping keeping the teenage and older athlete going?
Love to. Well, look, I've actually had a long-standing interest in this. Really, the horse that really taught me how to ride way back when was an older horse, and I think that really was very meaningful because the horse knew everything it was teaching me, and what a lovely way to learn. And that kind of interest has carried through my 30-something-year career now, where they tend to be puzzles. They can be fabulous performing animals, and something knocks them off, or they just, the straw that broke the camel's back sort of things. Just they're kind of maintaining themselves with some issues, but just something happens to kind of push them over the edge. And so sometimes they're just the most fascinating puzzles if you look at them that way. But by the same token, they tend to be just wonderful animals to work with and work on because. Look, they've been around the block. You can learn a lot from them, and they really can teach you as veterinarians some things. And, for the most part, the ones that hang on and persist at the upper levels, those are pretty tough horses. And so they're very tolerant of some of the things that we do. And, it's just such a, I don't know, it's like a thrill to actually get them back and going. And, people tend to be very appreciative for that because they're very attached to these guys sometimes.
Mm-hmm. And can you tell us a little bit about what you do at your university? You're a certified or a board certified surgeon.
Right. I'm board certified in surgery. I'd say most of my caseload would be performance horse lameness. We do some backyard horses as well, and do some surgery. Clearly, I actually do a fair amount of skin disease also, so that's another time I see these guys because as they age, they're more likely to get tumors and other issues with their skin. So, but the nuts and bolts of it is just keeping really any age performance horse going, and that's what I spend most of my time with.
And Dr. Jones, can you tell us a little bit about your experience with equine athletes that are older than some of the others?
Yes, I'd love to. I'd have to say that majority of my practice is exactly that. I wouldn't say I have only geriatrics in my practice, but I do have a lot of older campaigning horses that have been around the block already, and they're safe for the amateurs to ride. So I deal more with amateur riders than I do with the professionals. I do have a few professional riders, barns and such, but a good chunk of our practice is the amateur owner and those horses that have already been through the jumps, the movements, the runs, whatever they need to do, and are safe for these older or just young kids getting into it to ride is very opportunistic for my clientele. And so this is a subject that's dear to my heart. I, too, grew up with an older horse that taught me a lot all the way up through vet school, and unfortunately lost him in my senior year of vet school at age 28. So I was very pleased to have an aged horse to teach me so much through his life, and I feel it's definitely our way to give back to them. And it's funny because 28 seems old, but right now we've got 28-year-olds that are performing and out there doing the sports. And I think 30 is now the ones I go wow to, and the 28-year-olds I go, yeah, they're still doing it. That's great.
And I have to say, I have I have a 13-year-old that I just bought his first bag of senior feed for. So, and we're going to definitely get to talking about senior horse nutrition, but it's a broad span of ages that we're dealing with, from these early teens to their 30s. But Dr. Rashmir, I interrupted you. What were you going to say?
Well, I think Dr. Denny's quite right. It's like 30 is like the new 20. Before we used to think um, like a 20-year-old horse was really, really old, and now, wow, a 30-year-old horse is really, really old. And 20, there are a lot of 20-year-old horses that don't seem so old anymore. I think it's better care, throughout their lifetimes, um, better understanding of how horses age and what to do to avoid, early premature aging in them. I think that has really helped. So I think the population has aged gracefully for the most part.
So I want to give our audience a quick review before we jump into these questions of our Ask the Horse live format. We're going to be starting with the questions that everyone submitted when they were registering for the event. If you have questions you'd like to ask live, you can go ahead and do that in the console in front of you. You also feel free to ask for clarification on any of the doctor's answers as we go along. We're going to do our best to get to as many of your questions as possible tonight, and we have some really good ones, so we're going to go ahead and get started. And with that, Dr. Rashmir, we've already talked a little bit about horses' age, but at what age do we consider a horse a senior horse?
I think there is a little bit of controversy about this, but in my mind, it depends a little bit on how big the horse is, a little bit on the breed and what its use has been. But, 13 to 15, I think, is kind of a standard sort of beginning of being a senior. Certainly by 18, I think most people consider them senior horses.
Dr. Jones, our next question is from Rebecca in Indiana, and she wants to know how important is it to have an equine dentist or your veterinarian examine and float your horse's teeth. She has a 16-year-old and a 20-year-old. Should that be done every year?
I think it's mandatory. It's in the best interest of your horse to take care of its teeth every year, especially at those ages. I tell people when they become teenagers, 13 on, you really need to do an annual evaluation, thorough evaluation of the mouth, and start equilibrating them regularly. That means every year, or a little less, or just maybe a couple months more, but year is the average. Not every 2 or every 3 or when they start to drop feed. It's every year. And the reason for that is there are some dental issues that we are now able to avoid by early examination and keeping them equilibrated. When they go out of equilibration, meaning they have wave mouth and hooks, that's when you tend to start having some problems with their teeth. Thus, it goes into weight loss and it goes into lack of energy due to nutrition not being consumed and used as it should. So it's annual and it's a must. It's part of your vaccine program. Just make it, put it in your mind, just like you do the farrier feet every 5 to 6 weeks. You need to take care of their teeth every year.
And Dr. Jones, we think of old horses and their teeth problems and them having maybe weight issues or not being able to chew as well, but do you, in your practice, see performance issues that these older horses have that are possibly related to dental issues?
Absolutely, absolutely. I mean, just to the simple, they start tossing their head. You can't have some of the horses in a Western pleasure even, or in your dressage test, or even going around the jumps, tossing their head consistently and losing really control or that contact.
And Dr. Jones, our next question is from Chris in Mississippi, and Chris wants to know if older horses that are performing really need senior feeds. Can you talk to us a little bit about what senior feed means?
Yeah, the senior feed was developed years ago. It was developed, unfortunately, after my 20-year-old passed, and I really wish it was around for him because he didn't really look the best as he passed. But the senior feed is made for easier digestion. So for those that are having problems with digestion, and digestion, again, starts with mastication, which is chewing, and it starts with good teeth. So if they're having problems because they have poor teeth, poor dentition, or they're having some problems with absorption because they're not gaining weight yet, their teeth are done and you've done everything else, your parasite program is good and all that, then the senior feed is meant for them to help them absorb the food in a better consistency because it's pre-cooked, it's allowed to crumble easier into the digestive tract and be absorbed easier. That's my simple way of describing it to the clientele. Now, if you do have one of these easy keeper 20-something-year-olds, you may not need to be feeding a senior feed unless you're putting them through some heavy work, and that would be, 4 to 5 day training a week and showing regularly. So do they need the senior feed? Yes, at senior age, it's easier for them to digest. It just depends on the horse's activity. If they are a pasture ornament, you're a weekend warrior that every 1 the month you're going on a trail ride, you may or may not need that senior feed. You may just need some sort of equalizer to your pasture. But that's a whole other topic of nutrition.
Dr. Rashmir, our next question is also nutrition related, and it's from Denise in Wisconsin, and she wants to know if joint supplements are warranted for senior horses. So this is something that we horse owners spend a lot of time thinking about and agonizing over. So what should we be looking for? At what age do our horses need joint supplements, and what should we be looking for in those joint supplements to make sure that they're working?
Great question there. Honestly, I would actually say that some horses, regardless of age, are better off with some joint supplements and supplements in general. And so, the question then becomes which horses exactly, and certainly ones that may be having some hard work or lameness issues already, regardless of age. And we know that as horses age, they have more and more problems with osteoarthritis. And so things that we can do for these horses to minimize inflammation so that we don't have to keep them on nonsteroidals like phenylbutazone and Banamine and Coxib. And that's really kind of the target. Things we can do to keep the horse comfortable without doing things that are damaging to the horse. And so, those tend to come in some big classes, and one of those is certainly the Equine that's made by Nutramax that has sponsored this. And there's a product that's basically chondroitin and glucosamine supplement. And then we generally also, when we have put clients on, we actually use the Equine ASU for the most part. ASU, again, another good anti-inflammatory for the horse. And so there's been lots of studies on these drugs, and we know that the quality products, like the Equine ASU, have stood the test of time because they've been analyzed by outside labs. They actually have what they say they're going to have in it and what's on the label, and they actually have it in the right amounts. And so certainly, it's not a matter of the most expensive. It's not a matter of getting a good deal. It's a matter of feeding something that you really intend to feed and feeding it in the right concentration. And so I think that actually can help a lot of horses. Now, it's not going to help every horse, but I think that's a reasonable way to start supplementing for joints. Okay. I also think that we could get a lot from some of the omega fatty acids in horses. Most commonly in the horse, we use flax. There's been decades of work to show that flax is a good anti-inflammatory for horses, but it should be either freshly ground or stabilized and then dated, so that we know that we're giving it a time optimum for the anti-inflammatory properties. Kind of an interesting thing that came out here recently, a nice manuscript on resveratrol, which is an interesting study. Looks like it was well done, and looks like that's going to be something that's going to become more and more of interest for supplementing some of these senior horses and other horses as well. And then I'm sure Dr. Denny probably has some other thoughts about different supplements that may be useful.
I 100% agree with you, Dr. Rashmir. I saw that article about the resveratrol, and I was pretty excited about reading that, and then look forward to what's coming out with that, as well as not every horse really does need that joint supplement. It depends on how much use they've had and what they've done and what they're continuing to do. So some of these older horses had done tremendous things at a younger age, and they're still doing very good things for their age at a lower level, and they may not need all that extra joint supplement. So I agree.
Right.
And I'm a big fan of the ASU products because those have been looked at the orthopedic labs and have been justified that the ASU part of their products are a good supplement added to
right.
the diet for joints.
And it's really the only place you can get it in that kind of concentration is the Equine ASU. So it's kind of a double bang for your buck. The other thing too, that when we're talking about this and feeding supplements as they age and all, one of the things that does surprise me is how people really don't understand how important hay is. We spend a lot of money on supplements, but sometimes we don't really think about some of the basics. And gosh, we need to actually also rethink just making sure how these horses are fed with hay, because that's certainly the most important part of their diet. Even older horses, unless we have got them on full pelleted feeds because of their teeth or whatever. But the other thing I think we got to do for the money, you get a lot out of just getting a hay analysis and making sure you've got enough protein for all stages of the horse's life. And for the horses that have the Cushing's sorts of diseases, making sure it's not too much soluble carbohydrate and all. So Anyway, I had to throw that in. Sorry.
Yeah, yeah.
No, I think that's great because I'm going to add to that I agree. That's where I find the biggest lack of education is in the hays. And I've had a gentleman locally give a talk here and there on hays and hay products that was very knowledgeable in the hays, which did seem to help out my clients. But living here in Florida, we got our wonderful coastal hay that has absolutely little dietary nutrient fact to it. It's like eating iceberg lettuce for the humans. And
yeah,
they really
sometimes
can't
it's true.
the way they just keep themselves filled on it.
Yeah.
And then again, you're talking about those with the poor dentition on the full feeds. I have a 30-year-old pony here that has no dentition, and I pretty much say no dentition. She quids her food. We have quids all over the pasture, and that keeps her happy to be able to go out there and chew her grass and quid it back out. She just swallows very little of it. But I still do, instead of the pellets or the grain, she does do the senior diet, of course. I still do a soaked cube, because I think that the roughage part is definitely necessary for the hindgut to work and to do its proper job. And I think she's kept going here for at least the last 5 years of quitting because I give her that roughage.
So, we've talked about the oral supplements, but we have a question from our live audience from Gretchen, and she wants to know about injectables such as Pentosan or Adequan for treating or preventing or managing arthritis. Dr. Rashmir, do you want to jump in on that one?
Right. Actually, I did some of the original research on Adequan, so I have a strong feeling about them. But I will tell you both. They're very similar drugs, and in many ways, they're both inhibitors of certain proteases, so they get the collagenases and the things that are really important to joint health and other things as well. But one thing I will say, look, if you're going to use them, you're going to go into the expense of using them, I would use them appropriately. One of the things I see a lot of clients doing is just the once a month shot of, say, Adequan or once a month shot of Pentosan or something. Look, those drugs are actually meant to be used a certain way, and it's the series. And so you'll actually probably spend less money in the long run if you actually give the series as it's intended. And sometimes in bigger horses and horses that are really performing in just very strenuous levels, sometimes I give both the Pentosan and the Adequan. You have to be a little careful when you do double up like that with bleeding. But there are ways to use them appropriately. And the once a month, there's really no research to show that that's actually effective. So I would actually give it in a concentrated way, and then as the horse needs it, give another concentrated way, the series as it's intended. So, but yes, I think that I've actually made a lot of horses more comfortable with both of those, actually.
I agree. I'm a huge fan, again, of Adequan, as Dr. Rashmir is, and the appropriate dosing of it is every fourth day, 5 mils, or the company is saying possibly a little bit more, because 5 mil was basically based on a 1,000-pound horse.
1,000-pound horse, way back. Right.
Yeah, we're using on 1,200 and 1,400-pound warm bloods, and so the 5 mils may need to be up to 7 or 8 mils, and so it should be dose dependent, but it should be once every fourth day for 7 doses. And I have quite a few clients that maintain once a year on that Adequan, and they don't do the once a month, and they actually save. They're only using 7 vials or a multi-dose vial, and that's a lot less than the once-a-month shot. And we have done horse owner seminars, and we've actually had the technical vet from Adequan who stressed that that's the only way it's been researched. The once-a-month is not. But she did say, if you really are going to do the once-a-month, don't pick a random date. Do it within 3 or 4 days of the show so you get the best bang for your buck.
Right.
So let's be logical about the use of this drug.
Right.
Let's use it closer to the time that the horse actually needs it, and do it appropriately. But the best thing is to use it as it is instructed, which is every fourth day for 7 shots.
Well, I'm going down the checklist of all the things that my 15-year-old Hanoverian gets. So he gets his oral supplements, he gets his injectable, and our next question from our live audience is about joint injections. Carrie said that a friend recently started her mare on an injectable joint treatment. Her horse is also a jumper, is several years older. Her horse is older than Carrie's horse. Should she be using a product like this on her horse? And actually, now that I read that, I'm wondering if she's talking about Pentosan or Adequan, but let's go ahead and jump into joint injections. Dr. Rashmir, when are those called for?
So, look, I have a lot of clients that actually want me to, tune their horse up and inject joints that they feel the horses had problems with in the past. And I don't have any problem doing that, but I also have had my joints injected. And honestly, I don't want them when I'm feeling great, right, at the beginning of the season. So, look, in my mind, the timing would be a little bit different. Certainly, any horse that has got pain that has been localized to a joint, and it's been radiographed, and you can tell what's wrong with the joint. But those are horses I think you're going to get the biggest bang for your money, injecting those joints specifically. The maintenance thing, it just seems a little, to me, a little timing-wise, like I said, not that great at the beginning of the season, because that's when the clients really want it. Hey, we're going to go start showing hard. Let's do it. I think that's the time where you might go with the intramusculars, like the Equine, Pentasan, that sort of thing. Maybe even IVHA, which we haven't talked about yet. But for me, when the horse starts, maybe the 10-meter circles aren't as easy, or the turn on the haunches, or the spinning, or whatever it is, the sliding stops. I think that might be the time to kind of do more of what you might consider to be a maintenance sort of thing. And then, what do you use for maintenance? We know that horses over 15, 30% of horses over 15 have the Cushing's disease, Cushing kind of syndrome is what I would call it, but PPID or Cushing's disease. And, those are horses that I have a very high respect for. The problems with steroids in those horses that potentially can cause. And I know there's been some studies showing both ways on that. And so, sometimes I'll go to drugs like, that probably are our newest favorite thing here is going to be Prostride, which is, not steroid. It's actually made from the horse's own platelets, in fact. And, I think that's maybe a better way to go for some of these things. Now, there are a lot of horses that get their distal intertarsal joints, distal intertarsal and tarsal metatarsal joints, the distal joints in the hocks, injected regularly with steroids. Again, if I don't need to give it, my preference not to. I do for people that really think it makes a difference. And then, when a rider who is savvy enough to realize that the horse is just not turning as well or something, and this helped last time, let's try that. I think those are times to probably concentrate on the joint injections. We just have to remember that joint injections are not without potential complications in the horse. And the complications associated with them are potentially life-threatening. Septic arthritis is still a possibility. As clean as you can be, it's still possible that you're going to get unlucky and get a horse joint infected. And that can be totally catastrophic. And so I'd certainly feel a lot better if that happened. And so it's not going to have been lucky, but if it happened, I'd hate it to be over a horse that I didn't really feel like I needed to inject. Mm-hmm. So
I would chime in the same thing. I, too, have had my own joints injected, and something that I wouldn't want to have done on a regular basis. I step into doing that when I'm starting to feel uncomfortable, or when I notice a limp or something on my own. Why not do that with your own animal? And that's how I've always addressed it with my clients, is I can put you on a maintenance thing. And I think the big reasons that the upper, like you said, the tight spinners and those that are doing pirouettes in the haunches and things like that, those horses are possibly in a maintenance program because those riders feel like they can't take one step backwards. They're campaigning so heavily, and they cannot lose a point or a percentage or whatever. So they want to put them on a maintenance. So they're not taking the step backwards. But I believe that a lot of those horses will give you cues before you take that step backwards, and you can catch it in enough time to go ahead. I mean, if my amateur owners and their trainers can catch a horse that's starting to have a little problem with changing leads, or have a little problem walking out of the stall, or whatever the reason, then let's start addressing it then, and not wait until it gets so bad that they're bobbing their head.
So I'll give this one to Dr. Rashmir to start out with. So after you do the joint injections, how different should that horse feel? Should it be a significant, like, is it this miracle, or is it maybe just slightly better? Because I know, like, my parents have had joint injections for different things, and they've said, oh, it's amazing how much better they feel afterwards. I've never had my horse tell me, wow, I just feel amazing after my hocks got injected. So.
Gotcha. Well, look, steroids that we use in horses' hocks, they're still pretty darn rapid acting. Some people actually use the same drug that your parents got, right? But even then, within the first few days, that horse should be feeling better. It's interesting. If the horse feels better within, say the horse feels better for like 3 days, but then it doesn't feel better after that, you're probably in the wrong joint. because that steroids have basically gone systemic, and you've got the systemic effects, which pretty much make almost anybody feel better if has any sort of body pain. But to actually have a good effect from steroids, it's actually pretty quick. Now, prosteroid, about 2 weeks for maximum effect. HA, hyaluronic acid, we generally, in humans, they get a series, right? It's once a week for 3 to 5 injections. In horses, we generally tend to give it once. And then the people that really like it, they actually have come back and got it a little more frequently. I think they probably have a better effect. So it depends a little bit on what you're injecting, but and I'm guessing most of these people have been asking, or probably asking about steroids, and it should be actually pretty quick. Now, I give those horses a little time off. I usually give them 2 or 3 days off if I can. I don't stick them in a stall generally, but I, with a little bit of turnout, but I try a little, less force exercise in them. So they might get hand walked or something, but we don't generally, push them back unless, there have been times where the horse is in the middle of a show and just needs a little relief. But that also is a little problem with some of the testing rules, so we generally don't go to steroids with those horses either. But anyway, so the point is that it should be fairly immediate, and it should be sustained beyond that period of time if you've actually injected the right area.
Okay. So you mentioned PPID, and I just want to point out that our promo horse for this event is our brand manager's horse. So the horse's brand manager's horse, Chunder, is that horse jumping, and I think he's 18 or 19 now, and he is a PPID horse that's being managed and competed, and so he's pretty cute if anyone's watching, or if anyone can see him right now on the computer screen. He's adorable, and he was one of the inspirations for doing this topic. So let's talk a little bit more about Cushing's, and Dr. Jones, I know you deal with that quite a bit. We have a question from Renee in our live audience, and she wants to know what the best ways are for her to keep her horse with Cushing's as healthy as possible. Her gelding is 26 and doing well, and she'd like to keep him feeling good. He gets pergolide and grass hay and alfalfa, and he gets Cosequin ASU and senior vitamins to help support him. He also gets a little daily exercise and pasture time. So it sounds like she's doing a lot of things right. Dr. Jones, what advice do you have for Renee?
I think she's doing everything that she should do for him. And the only thing I could recommend is any sign she sees that he might be regressing in his disease, because this is a chronic disease. You're giving your pergolide, which is your Percend, and it's not going to be the cure-all. It's not going to make this go away. It's still there. It's still present. Once you stop giving the medicine, it's going to come back. But I have had numerous Cushing's horses or PPID horses that will get worse over time, even on the drug, and the clients find that out because all of a sudden they start drinking more and peeing more again, or they start losing their top line and do a little muscle wasting over the gluteals, even though they're working them 4 and 5 days a week. So things like that you need to really pay attention to. It sounds like this owner is a very attentive owner to her horse, which is fantastic. Dietary change is a must, and it sounds like she's already doing that. So with your PPID horses, you still need to do a dietary change and help them out. But I would say that maybe retesting him would be an idea that she could add to her program at some point in time, whether she feels it's just something she wants to do annually. It doesn't hurt. It's a blood test. It doesn't make a difference in the horse's lifestyle. She has the vet pull that blood, or she can just wait till she starts seeing a change in the clinical signs. Like I said, the excess of peeing, excess drinking, maybe some muscle wasting, the funky hair growth. Some people notice that it's slowed it down a little bit, but then all of a sudden it starts picking back up.
Right. The other thing, too, I think it's important, funky hair growth is in 10% of those horses with PPID or Cushing's. It's really in a small percentage. Yeah. And so a lot of people won't. Yes, exactly. And so a lot of people think their horse doesn't have it because it doesn't have the funky hair growth. But in fact, most horses that have it don't. And so, I just encourage people that, have older horses because, like I said, 30% of them will have it. It's worthwhile finding out before they get laminitis or some of the other signs that go with the disease. The other thing I will say about the poster child for this talk is I would just applaud her exercise, because we know exercise can partially reduce the age-related declines in not just cardiovascular health, but exercise capacity, the ability of muscle to repair, just lots of things that go along with aging. And
joint health, yes.
And joint health, absolutely. That is a big thing for joint health. So turnout's important. And when you have a horse that's got Cushing's, we really worry about turnout because they might overeat grass, right? So that's where the grazing muzzle comes in. They can get maybe a lot less grass with it. It's definitely worthwhile keeping that horse, stretching down to take bites of grass and stretching the neck, stretching the back, keeping them walking. Confinement's probably the worst thing you can do for aged horses. The horse gets stuck in a stall because he's gotten older and they're afraid of turning him out. Well, shoot, that's the opposite of what we want. We want those muscles being used. We want the horse walking and stretching the whole time. Like little grandmas that get up and do the morning sort of ritual of getting a little exercise and walking the dog, that sort of stuff. They tend to do a lot better than the ones that stand in front of sit in front of the TV, and don't do things. So the horse is no different.
Absolutely. Well, my mother is a candidate for that. She would walk the mall, and her first lap on that mall was excruciatingly painful. But by the second and third lap, she felt better, and she could go on with her day. She does now have both knees replaced, but initially, before that time came, walking the mall was the way she would do it.
And that segues really well into our next question, Dr. Rashmir. It's from our live audience. Jen has a reining horse that's in her late teens. She's wondering if she should give her mare winters off from work as she gets older.
Well, great. That's a great debate. There's some thought that reason that some horses don't have longevity is because they don't get time off. Because let's face it, you could find a show every single day of the week almost all year long if you wanted to haul that far, right? Or at least every weekend all year long. And so, if we're going down the road a lot with these older horses, that probably does take a little bit of toll. So some time off is probably good. But time off isn't time off standing. Time off is time off with maybe not going down the road, not having those sorts of stresses on the horse, with a little light exercise, pasture turnout, that sort of stuff. Look, I love that idea for the horse, but just keep the horse in a small area, around pen sort of thing, and think you're doing him a favor. I would say you're probably not. But a break from the hard action, I think, is worthwhile.
And we have a question from Liz in our live audience, and Dr. Jones, I'm going to give this one to you. She wants to know if there are any special considerations that she should make when transporting her daughter's senior horse from shows or to shows and to lessons. What are some of the concerns and prevention we can have with these older horses, having them in the trailer and then also going to new locations on a regular basis?
I wouldn't say that the answer I'm going to give you is going to be one because of it's a geriatric horse. It's going to be one for just every horse. Every horse has a personality that allows them to adjust or not adjust well to new environments. So it depends on that horse's personality. They might be one that loves to go for trailer rides and go to new adventures and new events. And those horses are really easy to get along with other horses and other smells and things like that. My biggest pet peeve is when I have people come to my clinic here and show up and there is no shipping boots on those legs. A large horse in a small trailer, there's no pole protector on their head. I don't know how many times I've sutured up filleted poles or forelocks. And then
head bumper is worth its weight in gold. Yes.
Yeah, and had to euthanize a horse because they, filleted their legs so bad that it went down to the joint on the lower limbs because there's not much protection there. It's skin over bones and joints and tendons. So, a geriatric is just the same as a 2-year-old is just the same as a 15-year-old. I don't care how many times they've been on a trailer and they're comfortable. Please protect their legs. Please protect their head. And if you want to do a tail wrap because you like the pretty long tail, that's your choice. But those are the primary areas that I want to see them controlled and taken care of. They did a wonderful study a few years ago, probably many years ago at this point, that I'm going to age myself here, that spoke about horses' placement in trailers in their most comfortable way. And ironically, and it's what I would love to do, show up at the big shows in my big stock trailer, cowboy stock trailer, with my horse not tied and loose, because that's the way they like to ride. And they pick the direction they want to stand, and more times than not, they want to stand backwards. And they found the heart rate monitors on long-distance travels that their heart actually went down. The heart rate was lower for most of the travel if they faced backwards. And so I'm sure people are cringing with this discussion I'm having right now, but that seems to be the best way with a horse, as well as, on top of all that, don't go through multiple stoplights. I have people who come to my clinic, and we have toll roads here, and they'll avoid the tolls on the multi-axles of their trailers and go down the roads with all the stoplights. And they have this horse whose heart rate's going up and down because every time they stop, the heart rate goes up. And every time they take off, the heart rate goes back up again. So, it's a fluctuation in the horse, the stress on the horse to do the start, stop, start, stop. So, those are my points, and that just affects every horse from young to old. The starting and stopping, yes, that would probably be easier on an older horse if you didn't have to do so many of them because they have to brace themselves and their joints are a little bit more achy than the younger ones. But in general, for cardiovascular reasons and stress reasons, it's better not to do the starts and stops for those reasons as well.
What do you think about horses that are a little bit sore? I think some of those actually like to lean. I think there are some horses that might even prefer, particularly for the longer rides when they start to get fatigued. I think some of them actually like to actually lean against the walls or lean against the butt bar and that sort of stuff, which certainly in a stock trailer they're not going to be able to do. Do you ever find horses that you think actually trailer better when they are, kind of paneled up?
Yeah. And I see that some of those who are probably tired like to lean against something or, might be a little lame, might like to lean against something to get some weight off of something that's a little painful, especially if they're coming back from a 3-day weekend show.
Oh, I had a friend at the barn who had a trailer that the horses were rear facing in it, but also confined, so it had padded panels so they could lean against it, and you loaded from front to back. And I have to say, my horse looked at that like, you want me to do what? What are we doing?
Right, something different. Yep. I love that about horses. What do you mean? Yeah.
The only horse trailer I've ever seen like that, and so and I wish I could ask him, was that a better ride backwards? Did you like that better once you were in there or not? But he hasn't told me one way or the other. But
what about mats? You guys think about mats for older horses in the trailer?
Or bedding.
I like them, and also that's the other thing. Yeah, that's the other thing is throw bedding down because they're either going to sweat in a warm environment and drip. Some of them profusely sweat, or you got them urinating in there and they become slippery. All those things are definitely a must. And you've got shaving center to collect up any of that wetness and keep it
ammonia,
dry.
Right? Yep.
What about and the ammonia smell? Yeah.
What do you do for horses? If you put shavings in there, do you actually put fly masks on, trying to keep the dust out of their eyes, or you just don't close the windows? Or what are your thoughts on that part? I know some people feel very strong about that.
Yeah. Well, there's a lot of them that are so closed up that it won't matter if they have a fly mask on or not because there's really not much air movement in there at all.
Right.
Yeah,
right.
But the stock trailers, the fly masks I think are pertinent because of things flying from other cars and vehicles up, not necessarily the straw and the sawdust. It's more from other things flying through the air from cars and such.
Right. The other thing I think is worthwhile mentioning too is tying horses. Just be careful so the horse can actually get its head down and cough. That's been shown to be really worthwhile for preventing horrible respiratory disease, pneumonias in horses. And then while we're at it, because I live in a cooler climate now, I'll have people pack horses in tied to a trailer, and they all have blankets on. And then by the time the horse gets someplace a couple hours later, and it's no doubt about it, it's really cold outside, but inside that trailer is about an oven because of the body heat. And so, sometimes it's actually better to take the blanket off and have the horse chilly for a few minutes than it is to have them just, particularly if they're going to perform that day, washed out with sweat for a couple hours on the way. So just some thoughts.
Very good point, Anne. I don't have to worry about that down here.
There you go. I know. What's a blanket, right? You got fly sheets down there.
Oh no! I got clients that have blanket their horses with the long hair at below 60 degrees down here. So, and I just chuckle myself as I drive by.
Well, our next question is for Dr. Rashmir, and it is from Shelley in Colorado, and she wants to know how important footing is in the arena to an older horse's longevity. Do you have any thoughts on what kind of footing we should be riding our horses on?
Oh, well, that's going to be, I think it's going to be very dependent on the weather, on what kind of barn you have. Certainly some of the footing that would be good in some areas would be very dusty and bad on the horse's respiratory system in other areas. The closed barns or the barns where the stalls actually abut up to the arena, those have got to just be, it's just, respiratory disease in horses, in older horses, it's accumulation, right, over time. And so it is something that we probably need to take on an individual basis. But here's the thing about footing in general, right? And that is, look, you can do a lot with footing by just keeping it worked well. Dragging it. Look, there's sand footing areas that are appropriate as long as it's not too deep. You can do or a lot of combinations of things to get good footing. It doesn't always have to be Kentucky Horse Park sort of, expensive footing.
But
To
we
have
wish
something
it
that's safe for
was.
your horse. There you go. There you go. We
Uh,
actually have it here. We actually have it here in our Linus area, and I will tell you that it's lovely. But and horses do ride really well on it, no doubt about it. They're comfortable on it. But there are a lot of good footings. There absolutely are. Not too deep is just as important as having enough give. And that footing in a horse arena is where you ride probably is an hour-long conversation in and of itself. Just my thoughts on it.
Okay. And you mentioned the horse's respiratory system. This question is from our live audience. Michelle is listening, and Dr. Jones, she has a 21-year-old hunter jumper that coughs at the beginning of each ride just a few times. Could this be her just clearing out her lungs, or is it an indication of something else going on? And I'm curious about the answer because mine does this too.
Well, anytime that becomes a consistent behavior, I always say it needs to be checked out. If it happens once or twice a year, it may just be a random act. But if it's consistently every time you get up and ride or every week, you need to have that checked out. When you have a blatant cough, it could be many factors. It could be a simple mild allergy that we don't quite have worked out in horses yet, all the allergies that they do have, to full-blown heaves. And the full-blown heaves, which now they have the new name equine asthma instead of heaves, so it's changed name numerous times from COPD to heaves to now equine asthma.
Yep.
Yeah, so that would be the worst case scenario, and worst case I mean as in it's a chronic problem that you'll have to deal with on a regular basis of keeping the horse comfortable.
I'm going to quote Ed Robinson here, and that is, horses should not cough. And
yeah.
just like Dr. Denny said, look, maybe they get something down their throat once or twice here or there over the year. Okay, but yeah, regular horse should not cough at the beginning of a ride or any time during the ride. So I would think it'd be worthwhile her investigating before it got any worse.
And there are plenty of interesting ways to investigate those. You can start with your veterinarian there and have them do a good full evaluation, physical exam. They may pick up something with that. Then you can go as far to treadmill work if your horse is comfortable with that. Or now they have the endoscopes that can be placed inside the horse, and they view it from afar while the horse is being ridden. So there's a lot we can do now for these horses that have respiratory problems.
Right. And the other thing too, because the horse's chest wall is so thick, when the vet listens to their lungs, they need to put a rebreathing bag on, which is basically us telling, or our RMDs telling us to take a deep breath. So the rebreathing bag, which is generally a big garbage bag, causes the horse to breathe very deeply over time, and it's just the best way to listen to those lungs. And so you can pick up things with that you would never be able to pick up without it. So if your horse is coughing, a rebreathing examination by a good veterinarian, definitely worth your money.
So I sigh because this is something I guess I need to talk to my vet about. So it shows what a puzzle these mature athletes are, because I'm always thinking about the soundness and the lameness and the feet and the and his body condition and his back, and we've never really talked about
whole
the cough.
Horse, my friend.
That's
right. Yeah. The whole horse.
So I guess
well.
I guess I better remember to mention that at our next appointment. So, Dr. Jones, our next question is from you, and it's from Kina in Canada, and she wants to know ways to help manage swelling in an older horse's legs. She has one that happens to stock up after jumping. What suggestions do you have for that?
Well, I would guess, being from Canada, that they have the horse put up in a stall after she's done, and back to what Dr. Ashmere was saying, turn the horse out would be my number one, because I see less swelling in aged horses' legs when they're turned out. I'm concerned that she probably is in an icy slope area that might take a risk of skidding out or whatever in the pasture, and so that's the reason they're not turned out. But I believe that turnout really helps these horses quite a bit because they will continue to move around. If you have to stall the horse, you're at a show, you're in a facility that doesn't have great turnout for your aged horse, you'll probably have to start doing some evening or stall time bandages to help manipulate the fluid out of the legs. It's just the same as compression hose in humans that people use for flying or they use for everyday work to help move the fluids from their ankles up the leg. And the same idea we're going to need to do with the horses is apply some firm bandaging techniques to the lower limbs, all four, to help keep the swelling out of the legs.
I think too, icing the horse after exercise. I think I've had a lot of good success with that. And really, anytime you really put a horse through a lot of work, particularly these older guys, some ice or at least cold water hosing massage can help these.
Basically, or an ice massage even too. The ice massage.
Ice massage for sure.
In a cup,
ice water.
And you just raise water in there, and then you just peel it from the bottom, and just use as like a little roll on, and you just ice massage up the leg until it melts out of the cup, and you're all good.
Right. So, even if you've got the means to do it, some of the ice booths tend to be really good where ice and water circulates at a cold. I mean, that's certainly very worthwhile having for some of the barns that actually have some athletes that work very hard. And absolutely the bandaging. I will say this too, and I've definitely lived in areas where there's plenty of ice. The snow pads help quite a bit. Borium on the shoe helps, so you can actually still turn these guys out safely to some extent anyway, depending on just how slick it is out there. But then preparing the area before it gets snowy so that you don't have the water running into it to make total ski slope sort of ice. But you can actually turn horses out in the winter a lot of the time, even horses that are very, very valuable, so that they actually get the exercise that they nature intended them to have, and that's going to help.
And we have a question that's related. It's from Marissa in New York, and she said that she volunteers at pony club rallies a lot, and lots of times she sees older ponies and horses at rallies who are really stiff because they aren't used to being stabled all the time, and so they go to the rally and they're stuck in the stall, and then they get stiff and they're sore, and then they get stocked up. What recommendations do you have, Dr. Rashmir, for those ponies that are older that aren't used to being in the stall at the show?
It's tough. I mean, no doubt about it. It is tough. Look, hand walking, if they can, anything to keep those guys moving, very helpful. And depending on the rules of wherever they're going, a little bit of non-steroidals can help. Most of those things 24 hours ahead, but depends on what type of older horse sort of show they're doing or campaigns they're on. A little bit of bute certainly might take away some of that stiffness or help take it away. The other thing that we haven't really hit on, which I think I really do like quite a bit, would be the dynamic exercises for horses. The stretching of the back. I think probably my favorite would be the Hillary Clayton and Nerel Stubbs. Nerel Stubbs being the main author of that. Where it actually goes through the carrot stretches. It's dynamic mobilization of the core. And anytime you get those guys stretching, even if they are stuck in their stall while they do it, or in the it won't be the cross size, but in the aisleway, look, that's still mobilizing tissue and in getting the horse's core so that the core maintains the horse, so that the action of the limbs becomes secondary, so that you can actually support the horse with the core and take less of burden on the horse's limbs. I also think that I'd like some of the other things that have come up with rehab, like the bands. I think that can actually help a very short period of time in the bands that gets really some muscles moving that wouldn't normally, something that they might not be using at the rally, but it would keep them at least, you could do that for just a few minutes, and then when the horse went to a class or something like that, it wouldn't be tired out from it, but it actually have a pretty good stretch in those. I think some of those things probably are very worthwhile in the guys that suddenly have to go in a stall.
I agree with that, and I believe the pony rallies I've worked, most of the horses are actually quite a bit, I wouldn't say quite a bit lame, but they're significantly short-strided because they are older horses that are safe for the kids to learn.
Right.
And that's their point of them, is they aren't going to take off at a lightning speed because they don't have a lot of get up and go because they are a little bit creaky. And most of these kids I've seen, and I believe it's kind of a Pony Club Rally requirement, are out there hand walking the horses. I see them hand walking all the time. So I don't know if it's a requirement or not, but I see it a lot.
I think it's a big plus. And, I love having young riders like that realize that they're helping their horse by getting them out and exercising them. That's just a really good mindset, I think, for them to have. So, and they're exercising themselves too, right? So I think it's a win-win.
Yeah. So we have a question from our live audience from Carol, and she wants to know if naproxen can help senior horses with aches and pains. And that's along the same lines of a question from Kathy in New York, who wants to know if you have any thoughts on long-term use of firocoxib for the comfort of an older horse that's in daily work. Dr. Jones, do you want to take that, and then Dr. Reshmer?
Yeah, I'd be happy to. I think any of the what we call nonsteroidal anti-inflammatories do help, but they do help while they're in the system, and that's pretty much about it. So it's the same for you and I. When we get something painful, stiff, whatever it is, and we take a little Advil or we take our little Tylenol to kind of help us get through, it's going to work during that time, but it also gives you a little bit of a reboot. And so if you continually have problems in that joint or that muscle that's sore because you've pulled a hamstring or you've tweaked the knee or the ankle, you're going to continue to have problems within those areas affected if you don't address them with some sort of rehab. So giving them those nonsteroidal anti-inflammatories help on a short-term basis. They should not live on them because of the side effects that you'll find. And, everybody knows about the abuse side effects of gastric ulcers and as well as the Banamine. And everybody now has been going to the firocoxib to try to avoid those. But the whole point is they shouldn't be living on those medications in my mind, because there should be some other addresses of where the pain is stemming from and getting to the sources of problem. I can speak that from experience because I'll be living on quite a bit of Advil for days on end if I don't get to the gym. And if I get to the gym, I can start stretching and working out some of the kinks that I've got.
Well, this will actually be the first time that Dr. Danny and I disagree. So there you go. It had to happen eventually. There you go. So this would be an area where, look, it's not for every horse, and certainly some horses tolerate the nonsteroidals better than other horses. But I think of the lesson horses that, look, those guys are just campaigners and taught many young riders, really good for equine veterinarians. That group along, right? And they're worth their weight in gold. But boy, I'd rather have them on daily firocoxib or even bute, as long as they tolerate, as long as they're eating, they're not showing signs of gastric pain or anything like that. And periodic checks, to make sure that everything's going well, livers and different things depending on the nonsteroidal. I do have a fair number of horses and have now for, I would say, many years. But then I'm of the age when it was nothing to give a horse 4 grams of bute a day for several weeks in a row. So it's probably a little bit different, my perception of these drugs than others, which is not surprising. But so I do actually have horses that I keep on long-term nonsteroidals. There is a kind of an additive effect over time. So if you keep them anti-inflammatory for a while, there is a little bit of a carryover. But for the most part, it's true. I mean, once it's off, the horse is going to go back to how it was at some level. And but the the comfort level the horse would enjoy, I just weigh it, against some of the the side effects that occur. I'd much rather have a horse get a little bit of nonsteroidal and keep going than a horse that no longer can be used, in that fashion, but be it lesson horse or higher level horse. So, I prefer to actually keep them on probably more drugs as far as it goes, as far as, drug testing would allow. And just keep the horse going, because I think longevity-wise it's better for the horse. And, there are plenty of horses that once they quit being able to be used, they're not going to have a life anymore. And so in some ways, I think I'm going to keep them as comfortable as long as I can until they can't be kept comfortable anymore. And so, like I said, I have maybe a little bit different. But then, of course, I'm quite a bit older than Dr. Denny, and I probably need more Advil. There you go, Dr. Denny. Maybe I have a different view of it from that way.
Well, I also throw in the 2 cents of I throw in acupuncture and chiropractic on some of these horses too, which acupuncture is not a one-time shot. So it's kind of like doing your Advil every day or every other day or, twice a week or whatever to kind of keep yourself going, the acupuncture is going to be the same way. You're going to have to continue with the acupuncture to kind of help the pain relief. And so if people are able to do that rather than doing the anti-inflammatory, that's a better choice, I feel.
Right. Look, I would use all that, absolutely, and that's kind of the point, I think, as well. So we use like the supplements in order that we would have to use less bute or less rockoxib. So the Adequan and the Cosequin and um, the flaxseed, all that sort of stuff, so that we have to use less drugs that are potentially problematic for the horse. But at some point or another, horses age into enough osteoarthritis, and we know that older horses can have osteoarthritis in multiple joints. And so I think, some of them will be a lot more comfortable on some of the systemic nonsteroidals. The other thing we haven't touched on, we probably should, would be the use of bisphosphonates in older horses. I have used, I would say, a huge amount of bisphosphonate over the years. First Tildren, when we would import that from France, and now that both Tildren and Osphos are available in this country, I've actually gone to using more Osphos. But look, older horses do have osteoarthritis, the number one cause of lameness in older horses, and so, and usually it's not just one joint, right? That's a traumatic sort of a thing, maybe, but long-term wear and tear. We know that vertebra, the cervical vertebra, the basically the entire spine can have it, and so some of those drugs can keep these guys going without potential side effects that you would have for like long-term phenylbutazone or one of the other nonsteroidals. I will actually mention, though, that one of the side effects of those drugs is after being administered, they can cause some colic in horses. And one of the other problems that they can cause is renal failure. And when you put the two together, the potential to have renal failure from the drug and the horse getting a little bellyache from the drug, one of the things we know that we shouldn't do, and it's basically labeled this way as well, and we just got to keep in mind, if you do give that to your horse and they do get a little bit of a bellyache, they should not get nonsteroidals at the same time because you're more likely to cause problems with the horse's kidneys, renal failure. And so most of the horses, quite honestly, I've yet, knock on wood, I hope my next horse isn't the one, I've never had a horse yet to get them that couldn't just be controlled with just hand walking. But if that weren't able to control the horse's pain, then I would move on to Buscopan, which was antispasmodic, which won't cause renal failure. So, look, they have their side effects too, but they last quite a period of time, usually 6 months or more. You might decrease the amount of nonsteroidals you have to give those horses, and if you use them wisely, you won't have problems.
I agree, and you're right. But that's one thing we have not touched on, and the bisphosphonates is one that I have definitely been using a lot more of lately, Tildren and Osphos, especially in the older horse. They definitely keep these old campaigners a lot more comfortable, and all of them get checked for their kidney values prior to administering it, only because I'm just paranoid about giving it to one that's already having some renal issues, and then you slap that on top of it, and you just ruin that horse and that horse's life. So I just feel that's something that should be addressed. So those that are getting Osphos on a regular basis, they should probably getting some regular blood work on a regular basis too.
Right, and it's funny because I'm not so sure that they know what the longevity in the bone is for Osphos yet. At least I don't think I've seen it published. And it's going to be something like 6 or 9 months. And so, and look, I've given it to horses more than that, but I'm sure that some number of those horses probably don't even need it that often. And so, again, we use the drug when we need it, and we try not to overachieve with our administration of drugs because of eventually, the side effects will be more of the problem than the drug itself, or than what's causing the horse to need the drug itself. So.
Yeah. And I think that brings us to our last question of the evening because we are almost out of time, but I think it's a nice way to end. And it actually is from Shauna, our brand manager, who is in Kentucky. And she is asking this question for Chunder, the horse that everyone can see jumping on their computer screen if they've accessed this online. She said that her biggest question is about conditioning work we have to do to get ready for horse trials. How can I structure our rides to get more done with less pounding on his legs and to better care for his body after longer conditioning rides? Dr. Jones, do you want to start on that, and then Dr. Rashmer?
Yeah, and I'm sure Dr. Rashmer is going to have some really great discussions on conditioning and getting ready. I'm going to probably focus more on what you need to do on the downside of that, meaning as you're finishing up your work for the night and kind of putting him asleep, put him to bed type thing. I think the rehab idea. So, and I don't mean rehab as he's coming back from injury. I say a geriatric horse is going to need some stretching. A geriatric horse is going to need some slower work into and slower work out of what they're doing. And I know everybody's tight on time, everybody's busy, everybody's working, they've got multiple objectives they're doing through the day, they've committed themselves 3 and 4 different ways, but you really need to take more time with the geriatrics of getting them ready to ride and taking them off of the ride so that you don't strain or cause some problems with them, because they don't stretch as well as the younger horse does. The stretches, the carrot stretches that Dr. Rashmir had discussed are fantastic, and I do think that that's very, very necessary. We also like to go through with the clients, and I say we as the physical therapist I have on staff with my practice, with teaching the back hind leg stretches, and that seems to be paramount for some people because the horse is engaging a lot in the rear end in a lot of these sports and needs to have those hind end stretches that a lot of people don't think about doing. Forward, going backwards as if you're in a farrier position, but even more stretch, and coming crosswise underneath the horse. And then there's the core, again, that was discussed, that helps you with your top line. So doing rubs on the ventral aspect of the abdomen to help to get them to tuck up. They're doing basically stomach crunches when they do that. Or you can do, as we're taught in chiropractic, the 10 o'clock, 2 o'clock position at the top of the tail head. As you dig into the top of the tail head, the horse will tuck its rear end underneath and pull up its abdomen. And that's like doing stomach crunches. Be very careful, of course, standing behind your horse. Make sure you know your horse when you're doing something to that effect if you kind of shock them by doing that. But those type of things I think are very pertinent in an aged horse. So it takes a little bit longer in the prep to and the coming out of on your getting your horse in condition. But I think those stretching and core muscle things are very pertinent for the horse.
And Dr. Rashmir?
Yeah, I think when we're talking about conditioning too, sometimes we forget about some simple things like gymnastics training. 2 more times a week. We know that will just over Cavalettes basically. We know that the good evidence here in the last year or so that actually will help improve core strength training. The other thing too, one thing I would just encourage people to not do, and that is, it doesn't matter what the sport is your horse does, try not to do just that as far as conditioning goes. So if your horse is a jumper, please don't put it over, 16 fences all week long before the show. Please, change things. It doesn't matter dressage. Like, I know that we want to practice our tests, but by the same token, that's a horse that could benefit a lot if you're trying to really get conditioning by doing something else. Whether that something else is going for a very long walk, just trot sets, a little bit of, some of the shorter conditioning events, not typically interval training, but even shorter than that. So going at maybe a much faster trot for a very short period of time, basically 1 or 2 laps of the, or probably one lap of the standard size arena, like dressage arena, and then a slower, and then changing like another faster, another slower, just so the horse actually gets both cardiovascular and muscular conditioning that way. We know the one almost sure way to get a bow 10 is doing the exact same thing hard every day the same way. Right? Because you're putting that same stress so you don't allow for recovery. So just changing things up. If you've got a horse that would be standard lease, like running barrels, certainly it's best not to run barrels every day. Do something with the horse, even pony it. Look, I actually have had horses that were better off being ponied. A lot of those are barrel horses, but sometimes there are other horses that are aged. And if you can pony the horse just to do something different, get the weight off the back. Some horses actually really like being ponied, and it's, again, just another thing to do with no stress to the horse and just get it out and give it some exercise. So for me, what I would normally do is I sort of tailor a sort of a conditioning program for horses depending on what their event is and how old they are and how well they tolerate things, and we just build up over time. But I think that all those things Dr. Denny mentioned are absolutely true. But again, trying to get some variety in the horse as you're trying to condition it probably is the safest for the horse and probably the most interesting to the horse as well.
I think the horse will thank you when you do that too, because it'll be a mind break for them, and I think they'll thank you profusely.
Yep.
Well, unfortunately, that's all the time we have for tonight. I want to thank both Dr. Rashmir and Dr. Jones for joining us. It was a great conversation. Thank you both.
Well, you're very welcome. It was very fun. Thank you so much for having us.
Yes, thank you.
I also want to thank our sponsor, Equine, and finally, thank you to everyone who submitted questions during registration and also during our live event. Until next time, from all of us at The Horse, have a great night.